Hi friends, welcome to Nursing Online Education.
In this video, we will be discussing some important questions and answers for different nursing competitive examinations. So guys, let's get started. Here is our first question. The nurse is caring for a client who had a right below the knee amputation 3 days ago. The client complains of pain in the right foot and asks for pain medication. What nursing action is appropriate initially? And the options are below. A. Elevate the stump. B. Administer a placebo. C. Administer ordered medications. D. Encourage the client to discuss his feelings. Now, what do you think the correct answer would be? I will tell you right away. It is option C, administer ordered medications. Guys, please listen to our second question. During the assessment of an injury for a possible fracture, which of the following manifestations would make you suspicious that a fracture has occurred? And the options are A. Impaired sensation. B. Hotness. C. Loss of function. D. Pointed tenderness. And the correct answer is option C, loss of function. Moving to our next question. A client who has had an above-the-knee amputation develops a dime-sized bright red spot on the dressing after 45 minutes in the post-anesthesia recovery unit. The nurse should A. Elevate the stump. B. Reinforce the dressing. C. Call the surgeon. D. Draw a mark around the site. And the correct answer is option D. Draw a mark around the site. Guys, please listen to the very next question carefully. How you will interfere to relieve swelling of the lower extremity in a cast for 3 days now? And the options are A. Change the cast. B. Call the doctor. C. Elevate the extremity. D. Give massage. Correct answer is C. Elevate the extremity. Next question is here. The nurse is developing a bowel retraining plan for a client with multiple sclerosis. Which measure is likely to be least helpful to the client? A. Limiting fluid intake to 1000 ml per day. B. Providing a high roughage diet. C. Elevating the toilet seat for easy access. D. Establishing a regular schedule for toileting. And the correct answer is A. Limiting fluid intake to 1000 ml per day. Moving to the next question. A diabetic patient with foot gangrene undergone above knee amputation. While the nurse changing the dressing, he complains of pain on the same knee which was amputated. What should the nurse do? A. Inform physician about it. B. Redo dressing to assessment the wound. C. Psychiatry consultation to the patient because he wound above knee. D. Give analgesic as needed. Correct answer is D. Give analgesic as needed. Our next question is, a diabetic patient with foot gangrene undergone above knee amputation, he complains of pain and swelling at the wound site which is oozing pus and has a bad odor. The physician ordered cephalexin and metronidazole. Which of the following you should do immediately? A. Give cephalexin direct first action. B. Give metronidazole direct first action. C. Do wash on wound with N-sand put bacitracin. D. Do wash on wound with N-sand put hydrocortisone. And the correct answer is C. Do wash on wound with N-sand put bacitracin. Quickly moving to next question. The physician has prescribed a cleansing enema to a client scheduled for colon surgery. The nurse would place the client A. Prone. B. Supine. C. Left sims, left lateral. D. Dorsal recumbent. And the correct answer is C. Left sims, left lateral. Guys, listen to our next question. At which side of the patient will the nurse stand when inserting a rectal enema? A. Right side. B. Left side. C. Any side. D. Both sides. And the correct answer is option A. Right side. Our next question is here. While undergoing a SAFDARJUNG enema, the client complains of abdominal cramping. The nurse should A. Immediately stop the infusion. B. Lower the height of the enema container. C. Advance the enema tubing to 3 inches. D. Clamp the tubing. And the correct answer is option B. Lower the height of the enema container. Moving to our next question. The nurse must administer an enema to an adult patient with constipation. Which of the following would be a safe and effective distance for the nurse to insert the tubing into the patient's rectum? A. 1:2 cm. B. 3:4 cm. C. 5.5:6.5 cm. D. 6.5:8 cm. And the correct answer is D. 6.5:8 cm. Our next question is. The nurse is caring for a patient receiving 4 furosemide, Lasix, 40 mg and enalapril, Vasotec, 5 mg PO bid for AF with severe orthopnea. When evaluating the patient response to the medications, the best indicator that the treatment has been effective is A. Weight loss of 2 pounds overnight. B. Improvement in hourly urinary output. C. Reduction in systolic BP. D. Decreased dyspnea with the head of the bed at 30 degrees. And the correct answer is D. Decreased dyspnea with the head of the bed at 30 degrees. Moving to our next question. The nurse in preparing to insert Rull's tube, NGT, into an infant, the nurse knows that the length of the tube should be taken as following. A. From the nose down to the chin and then to the umbilicus. B. From the nose to the earlobe and then to the xiphoid process. C. From the nose to the mouth to the xiphoid process. D. From the nose to the earlobe to the umbilicus. And the correct answer is B. From the nose to the earlobe and then to the xiphoid process. Our next question is. The nurse is caring for a client who has had a chest tube inserted and connected to water seal drainage. The nurse determines the drainage system is functioning correctly when which of the following is observed. A. Continuous bubbling in the water seal chamber. B. Fluctuation in the water seal chamber. C. Suction tubing attached to a wall unit. D. Vesicular breath sounds throughout the lung fields. And the correct answer is B. Fluctuation in the water seal chamber. Our next question is. The nurse in preparing to insert Rull's tube, NGT, into an infant, the nurse knows that the length of the tube should be taken as following. Here are the options. A. From the nose down to the chin and then to the umbilicus. B. From the nose to the earlobe and then to the xiphoid process. C. From the nose to the mouth to the xiphoid process. D. From the nose to the earlobe to the umbilicus. And the correct answer is option B. From the nose to the earlobe and then to the xiphoid process. Our next question is. The nurse is caring for a client who has had a chest tube inserted and connected to water seal drainage. The nurse determines the drainage system is functioning correctly when which of the following is observed. And the options are A. Continuous bubbling in the water seal chamber. B. Fluctuation in the water seal chamber. C. Suction tubing attached to a wall unit. D. Vesicular breath sounds throughout the lung fields. And the correct answer is B. Fluctuation in the water seal chamber. Guys, listen to our very next question. The nurse is caring for a client who has just had a chest tube attached to a water seal drainage system. To ensure that the system is functioning effectively, the nurse should A. Observe for intermittent bubbling in the water seal chamber. B. Flush the chest tubes with 30 to 60 milliliters of NSS every 4 to 6 hours. C. Maintain the client in an extreme lateral position. D. Strip the chest tubes in the direction of the client. And the correct answer is option B. Fluctuation in the water seal chamber. Here is our next question. The nurse enters the room of a client who has a chest tube attached to a water seal drainage system and notices the chest tube is dislodged from the chest. The most appropriate nursing intervention is to A. Notify the physician. B. Insert a new chest tube. C. Cover the insertion site with petroleum gauze. D. Instruct the client to breathe deeply until help arrives. And the correct answer is C. Cover the insertion site with petroleum gauze. OUE next question is: which type of isolation category is indicated for patient with tuberculosis? A. Airborne isolation. B. Strict isolation. C. Reverse isolation. D. Contact isolation. And the correct answer is Tyan A. Airborne isolation. Here is our next question. While attempting to get out of bed, a patient accidentally disconnects the chest tube from the plurivac drainage system. Which of the following actions should the nurse take first? And the options are below. A. Insert the end of the chest tube in a container of sterile solution. B. Clamp the chest tube near the plurivac drainage system. C. Raise the end of the chest tube above the level of the insertion of the chest tube. D. Apply pressure dressing to the chest tube insertion site. And the correct answer is option A. Insert the end of the chest tube in a container of sterile solution. Please listen to our next question carefully. Which type of isolation category is indicated for a burn patient? And the options are A. Airborne isolation. B. Strict isolation. C. Reverse isolation. D. No isolation required. Correct answer the question is option C. Reverse isolation. Listen to our very next question. Which type of isolation category is indicated for patient with diphtheria? A. Airborne. B. Droplet. C. Contact. D. Blood. And the correct answer is B. Droplet. Here is our next question. A 68-year-old woman diagnosed with thrombocytopenia due to acute lymphocytic leukemia is admitted to the hospital. The nurse should assign the patient to A. To a private room so she will not infect other patients and healthcare workers. B. To a private room so she will not be infected by other patients and healthcare workers. C. To a semi-private room so she will have stimulation during her hospitalization. D. To a semi-private room so she will have the opportunity to express her feelings about her illness. And the right answer is option B. To a private room so she will not be infected by other patients and healthcare workers. Listen to our next question. A nurse who begins to administer medications to a client via a nasogastric feeding tube suspects that the tube has become clogged. The nurse should take which safe action first? Options are below. A. Aspirate the tube. B. Flush the tube with warm water. C. Prepare to remove and replace the tube. D. Flush with a carbonated liquid such as cola. And the correct answer is option A. Aspirate the tube. Here is our next question. Which of the following instructions is appropriate for the nurse to give to a female client who complains of abdominal upset after cholecystectomy operation? A. Increase fluid intake. B. Avoid fatty meals. C. Increase protein intake. D. Daily exercise. And the correct answer is option B. Avoid fatty meals. Here is the next question. Which of the following pulses should be checked before administrating digoxin? A. Apical pulse. B. Radial pulse. C. Femoral pulse. D. Dorsalis pedis pulse. And the correct answer is option A. Apical pulse.